If you're over 60 and you feel cold, heavy or unsteady in your legs, stop treating the symptoms with only socks and more walking. There is one simple drink you can take that often produces measurable increases in blood flow to the legs within hours, and yes, you can buy it at the grocery store. I'm Dr. Richard Coleman. I've spent more than 3 decades in geriatric medicine watching how a tiny chemical, nitric oxide, slowly disappears from aging blood vessels, and how restoring it can translate into warmer feet, fewer cramps, and steadier steps. If this message sounds relevant, tell me where you're watching from in the comments and hit like so others can find it. As we age, the cells that line our blood vessels, the endothelium, lose their ability to make nitric oxide. Think of nitric oxide as a tiny key that opens the door and lets blood flow freely. Without enough of that key, arteries behave like a crushed drinking straw. They don't open properly, flow is restricted, tissues get less oxygen, and the legs, being farthest from the heart, suffer first. The result: cold toes, aching calves after short walks, muscle cramps at night, slower healing, and yes, a higher risk of imbalance and falls. That decline in endothelial nitric oxide is a core physiologic cause, not just getting old in a vague sense. There are 2 practical ways to support nitric oxide levels. One is the body's own enzymatic pathway, which becomes less efficient with age. The other is a dietary backdoor. Nitrates you eat get turned into nitrite by bacteria on your tongue, and then into nitric oxide in your circulation. That nitrite nitric oxide pathway bypasses some of the age-related enzymatic loss, and it's powerful. Today I will rank 10 common drinks from the least effective to the most effective at helping this process, why some barely move the needle, and why one, taken correctly, regularly produces measurable increases in leg blood flow within hours. Before we start the countdown, remember 2 rules. Do not abruptly stop or change prescribed medicines without discussing it with your doctor. And if you have a history of kidney stones, low blood pressure on medications, or are under active medical treatment, check with your clinician before starting any new regimen. I'll remind you of specific warnings as we go. Number 10. Plain water is essential. Dehydration thickens your blood a little and can make muscles cramp. Good hydration helps with overall circulation and is the baseline recommendation I give every patient. But as a targeted strategy to increase nitric oxide or produce rapid vasodilation to your legs, plain water is at the bottom of this list. Hydration alone cannot overcome an age-related shortage of nitric oxide. Pro: inexpensive, universally available, safe. Con: modest circulatory effect, helpful for general health, but insufficient if your problem is endothelial nitric oxide decline. Number 9. Green tea. Green tea gets credit for long-term vascular health. Its catechins have antioxidant effects that protect the endothelium. Studies suggest regular green tea drinkers may experience slower progression of vascular stiffness. But if you're looking for immediate increases in leg flow, green tea is slow-acting and often caffeinated. Caffeine can transiently constrict some vessels and may not be ideal for everyone, especially those with arrhythmias or who are caffeine-sensitive. Pro: antioxidant protection over months to years. Con: slow onset. Effect size for immediate perfusion is small. Number 8. Tart cherry juice. Tart cherry juice has become popular for muscle recovery and inflammation. There is clinical data suggesting modest improvements in vascular function over time. Some trials reported around an 18% improvement in certain measures after many weeks of consistent use. But that benefit accrues slowly, and many commercial products are sweetened, which adds sugar and blunts metabolic benefits. Pro: anti-inflammatory and may help recovery. Con: slow, requires weeks, and sugar content is a real issue for older adults with glucose concerns. Number 7. Pomegranate juice. Pomegranate contains polyphenols that support endothelial health, and studies have shown beneficial effects on arterial stiffness over months. Yet the practical problem, again, is timing and sugar. Many juices are concentrated and caloric, which can be counterproductive for weight and glycemic control. For immediate leg perfusion, pomegranate sits low because it's more of a protective long-term tonic rather than a fast-acting vasodilator. Pro: long-term antioxidant support. Con: sugar, cost, and limited immediate effect. Number 6. Cocoa, dark chocolate drink. Cocoa flavonols reliably improve endothelial function by enhancing nitric oxide availability for some people. Clinical trials show improvement in measures like flow-mediated dilation over days to weeks. So, cocoa is not useless. But as a drink, you face trade-offs. Commercial hot chocolates are often loaded with sugar and dairy, which reduce the benefit. Tasting chocolate is pleasant, but the potency varies widely. This one tastes like medicine, in the sense that dark, high-flavanol cocoa works, but the average cocoa drink you pick up at a coffee shop may not. Pro: improves endothelial function via flavonols. Con: variability in flavanol content, sugar, and slower onset than nitrate-rich options. Number 5. Watermelon juice, L-citrulline source. Watermelon is a natural source of L-citrulline, an amino acid your body converts to L-arginine and then to nitric oxide. For some patients, watermelon juice or concentrated watermelon extract produces modest increases in nitric oxide over days to weeks. It's appealing because it's tasty and hydrating, but the absolute nitrate content is low compared with leafy greens and beetroot, so the nitric oxide boost is smaller and less immediate. Pro: pleasant flavor and contributes precursor for nitric oxide production. Con: lower potency. Benefits usually appear over days to weeks rather than hours. Mini hook. Number 7 surprised me. Beneficial, but the sugar in many preparations cancels much of the gain. Keep going, the next ones work faster, but you'll need a blender or a refrigerator full of greens. Number 4. Hibiscus tea. Hibiscus is a remarkable herbal beverage. Clinical trials show it can lower blood pressure modestly, acting in a way similar to mild ACE inhibitors. For circulation, that blood pressure lowering effect can translate into reduced arterial stiffness and better perfusion when used regularly. Hibiscus can be fast-acting for blood pressure, sometimes showing benefit within days. However, that potential is also why caution is needed. If you're already on antihypertensive medications, adding hibiscus could cause blood pressure to drop lower than intended. Pro: accessible, pleasant, and can lower blood pressure. Con: possible interactions with blood pressure medications. Talk to your doctor before adding it. Number 3. Celery juice, dietary nitrates. Celery is richer in dietary nitrate than many other vegetables, and celery juice has shown surprisingly quick effects on blood flow in some studies. Clinical data indicate that concentrated celery-derived nitrate can increase blood flow by roughly 35–40% within about 3 hours in some participants, an impressively fast time frame. It's practical. You can juice celery at home or find concentrated celery juice mixes. The drawbacks are taste. Some people dislike it. Seasonality and supply, and the fact that not all commercial celery drinks have consistent nitrate content. Pro: strong, fast nitrate source with measurable short-term perfusion gains. Con: taste, variability, and supply consistency. Mini hook. The next one delivers a powerful punch if you can handle the flavor, but preparation matters. Number 2. Arugula, rocket, smoothies. Arugula is one of the highest nitrate leafy greens available. Regular intake in concentrated smoothies has been associated with large improvements in vascular function. Some clinical reports indicate an increase in measures of blood flow, approaching about 42% after 2 weeks of consistent consumption. Arugula's peppery flavor and the need for fresh greens or a steady supply can be compliance hurdles for many older adults. Also, a smoothie can dilute nitrates if blended with too much fruit or dairy, so preparation matters. Pro: very high nitrate content, substantial improvements in a short time frame. Con: taste, need for blender and fresh produce, and possible refrigeration storage issues. And now, the reveal, the drink I told you about at the top. Number 1, beetroot juice. Beetroot juice consistently ranks as the most potent, most practical, and most evidence-backed nitrate source for rapid increases in blood flow. Clinical studies and practice data indicate that a single dose of concentrated beetroot juice can produce meaningful increases in blood flow and reductions in arterial stiffness within 3 hours. Repeated daily intake produces sustained improvements over weeks. Depending on the study and the population, increases in measures of blood flow or exercise capacity range, in many reports, from roughly 30% up to 50% in acute responses, and improvements in arterial stiffness and walking distance become measurable after days to weeks of regular use. How does beetroot juice do this? There are 2 key mechanisms to understand. First, beetroot is high in inorganic nitrates. When you drink it, those nitrates travel to your saliva. Bacteria on your tongue convert nitrate into nitrite. That nitrite then becomes nitric oxide in your bloodstream. This nitrate-nitrite NO pathway is the back door I mentioned. It bypasses some of the age-related decline in the body's own nitric oxide production. Second, beetroot also contains compounds that support endothelial function and reduce oxidative stress, so it's not only an immediate vasodilator, but also helps the vessel lining over time. Practical protocol. What to take and how. Drink 8 ounces, about 240 milliliters, of pure beetroot juice each morning on an empty stomach. No added sugars, no creamers, just pure beetroot juice. Chilled, straight. Do this daily for at least 30 days to evaluate how it affects your symptoms. Many people report noticeable warmth in their feet, fewer cramps, and better walking endurance within days, and objective improvements in perfusion are often measurable within 3 hours of a dose in research settings. If the taste is a barrier, small, careful modifications are possible without drastically reducing potency. Add a squeeze of lemon, a small piece of ginger, or dilute by no more than 1/3 with unsweetened apple juice. Avoid blending with dairy, whole-fat milks, or large volumes of fruit juice. Those additions can change absorption and add sugar. If you juice whole beets at home, run them through a fine strainer to make a clear juice. Homemade juice can be as effective as commercial pure beetroot juice, but commercial standardized cups make dosing simpler. What to expect physiologically and clinically? After drinking 8 ounces of beetroot juice, oral bacteria begin converting nitrate to nitrite, and within 1 to 3 hours, nitric oxide levels rise, producing vasodilation. Clinically, that translates to warmer extremities, decreased calf pain with walking, reduced sensation of heaviness, and sometimes mild improvements in balance because blood flow to muscles and nerves improves. With daily consumption, studies and clinical observations show sustained benefits. Reduced arterial stiffness, improved endothelial function, and better exercise capacity over weeks. Important cautions and contraindications. Do not use antiseptic mouthwash before or immediately after taking a nitrate-rich drink. Antiseptic mouthwashes kill the oral bacteria that convert nitrate to nitrite. This destroys the entire backdoor pathway and eliminates the beneficial effect. If you rely on an antiseptic mouthwash for dental reasons, speak with your dentist or physician about timing. Some patients switch to a non-antiseptic cleanser in the morning and preserve their nitrate pathway. If you have a history of kidney stones, especially calcium oxalate stones, be careful. Beets contain oxalates, and in susceptible individuals, a high oxalate intake could increase stone risk. If you've had kidney stones in the past, consult your physician before starting a daily beetroot protocol. If you're on antihypertensive medications, especially those that lower blood pressure substantially, adding high nitrate drinks or hibiscus, which can lower blood pressure, may enhance the blood pressure lowering effect. Do not stop or reduce your medications on your own. Instead, inform your prescribing clinician that you plan to start a nitrate-rich supplement so blood pressure can be monitored and, if needed, medications adjusted safely. Be cautious with sugar. Many marketed beet drinks come sweetened. Those added sugars blunt metabolic benefit and can be problematic for people with diabetes or pre-diabetes. Choose pure beetroot juice without added sugar. Beeturia, the harmless reddening of urine or stool that sometimes occurs after consuming beets, is not dangerous. It can be startling, but it's benign. It does not indicate bleeding. Antiseptic mouthwash detail. Why mouthwash matters. The oral microbiome is not just a nuisance. It's a functioning part of this nitrate pathway. Bacteria on the back of the tongue reduce nitrate to nitrite. Antiseptic mouthwash indiscriminately kills those bacteria, and multiple studies show that antiseptic mouthwashes blunt or abolish the blood pressure and blood flow effects of dietary nitrates. For best effect, avoid an antiseptic mouthwash around the time you take your beetroot juice. Ideally, use it at a different time of day or switch to non-antiseptic oral rinses and discuss this with your dentist. Putting the protocol in your daily life, practical tips for compliance taste, is the #1 reason people stop. Here are practical fixes I use clinically. Start with a smaller volume and work up. If 8 ounces is too intense at first, begin with 4 ounces for the first week, then increase. Chill the juice or serve over ice. Cold often reduces the earthy beet flavor. Add a squeeze of lemon or a small knob of grated ginger to improve palatability. Mix no more than 1/3 of the volume with unsweetened apple or white grape juice if you need sweetness. Strictly avoid adding table sugar. Prepare the night before. Pour 8 ounces into a labeled bottle in the fridge with a sticky note, beet juice, AM dose. Treat it like a medication. Place it next to your morning pill so you remember to take it on an empty stomach. If cost or seasonality is an issue, use frozen concentrated beetroot shots. Many reliable commercial products exist that standardize nitrate content. Check labels to avoid added sugar. Rotation and boosters. Beetroot daily in the morning should be your core strategy. You can rotate or add other nitrate-rich or supportive drinks to maintain variety and address taste or tolerance. Hibiscus tea in the afternoon, if you're not on interacting blood pressure meds, is a pleasant rotational option and supports blood pressure control. Celery juice can be used on days when beets are not available or you want a milder flavor. Expect fast effects, but be aware of variability in nitrate content. An arugula smoothie 2 to 3 times per week provides a potent nitrate boost. Prepare it with water or unsweetened nut milk and a little lemon. Rotate these options to avoid palate fatigue and to tap different phytochemical benefits. A 30-day challenge you can do at home. If you want to test this for yourself in a practical, measurable way, try this plan. 1. Before you start, take a clear photo of your legs and feet in the morning. Look for color, swelling, and visible varicosities. Make a note of night cramps, walking distance before fatigue, and how warm or cold your toes feel. 2. For 30 days, drink 8 ounces of pure beetroot juice each morning on an empty stomach. If you must take medications in the morning, take those after a short wait or coordinate with your physician. But do not stop any medications. 3. On alternate afternoons, consider a cup of hibiscus tea or a small celery juice as a booster, only if cleared by your physician. 4. Avoid antiseptic mouthwash around the time of dosing. 5. Keep a simple log, warmth of feet, cramps, walking endurance, and a weekly photo. After 30 days, compare the photos and your notes, what you can reasonably expect. Many older adults notice small, meaningful changes. Warmer feet, fewer cramps, improved walking tolerance within days to weeks. Clinical data show acute perfusion increases within hours and improved arterial stiffness over weeks. This is not a guaranteed cure for vascular disease, nor a promise to prevent falls entirely, but it is a low-cost, evidence-backed strategy that often improves the symptoms that limit mobility and independence. Clinical anecdotes, brief and anonymized. Over the years, I've seen dozens of patients try this approach. One woman in her 70s, who had long-standing cold feet and nocturnal cramps, began taking a daily beetroot shot. Within a week, she told me her socks felt looser because her feet were warmer, and she was sleeping better. Another gentleman, age 80, found that after 3 weeks of a morning beetroot regimen, he could walk an extra block without stopping for calf pain. These are individual experiences, not guarantees, but they reflect the physiologic mechanism at work and match what clinical studies show in aggregate. Safety recap. Don't skip this. If you have a history of kidney stones, consult your physician before starting daily beetroot due to oxalate content. If you are on antihypertensive therapy, mention your plan to your prescribing clinician. Addition of nitrates or hibiscus can lower blood pressure further. Do not use antiseptic mouthwash around the time you take nitrate-rich drinks. Avoid sweetened commercial juices. Choose pure beetroot juice. Do not stop or alter prescribed medications without physician guidance. Why this works better than walk more or drink more water alone. Walking and hydration are beneficial for many reasons. Cardiovascular health, balance training, muscle strength, but they do not directly replace the nitric oxide your aging endothelium fails to make. Dietary nitrates from beets and nitrate-rich greens bypass that failing enzyme system and generate nitric oxide through a separate pathway. That's why a single targeted drink can produce relatively rapid changes in blood flow that complement, rather than replace, standard recommendations like exercise. A note on supplements and standardization. Not all beet products are equal. Powdered mixes, shots, and whole juice bottles differ in nitrate content. If you use a supplement, check that the product reports nitrate concentration and avoid ones with added sugar or excessive fillers. Juicing whole beets at home works well if you can control portion and purity. Final practical checklist to get started tomorrow. Buy pure beetroot juice, no added sugar, or prepare fresh juice from whole beets. Commit to 8 ounces every morning on an empty stomach for 30 days. Avoid antiseptic mouthwash in the morning. Use it at a different time if needed. If you take blood pressure medicines or have kidney stone history, consult your clinician first. Prepare your bottle the night before and keep a simple symptom log and photo record. If you're taking the 30-day challenge, share this with a friend or family member who needs it and post updates below. I'll read your comments. Regaining better circulation is not a miracle in one morning, but it is a practical, evidence-backed pathway to warmer feet, fewer cramps, and possibly steadier steps. For many older adults, that kind of improvement preserves independence and quality of life. I'm Dr. Richard Coleman. If this helped, tell me where you're watching from and hit like, then start simple. 8 ounces of pure beetroot juice tomorrow morning on an empty stomach and see what a month brings.